Hello. So I wanted to make a quick video to update everyone on the various tests and I guess procedures that I've been having done. I realized I had updated somebody the other day and they're like, whoa, I didn't know all this was going on. So if I'm repeating something, I'll try to keep it brief and everything. But so far, I started with a breast MRI that was ordered from the breast surgeon, just to kind of get a view of what's all going on in there and to get an idea of what we're working with. So when I had the breast MRI done, that's when they saw a different spot on my left breast, which is where the breast cancer is, and also something going on in my lymph nodes on my right side, which is not where the tumor was. And also the breast MRI actually was able to get some imaging of my liver, which I didn't know. So it did pick up some spots on my liver that my oncologist then wanted to order a CT scan of my liver to see what was going on. She said she wasn't too concerned with it. It didn't seem something that was necessarily like an urgent flag, but I totally agree with her that if there's something questionable there, let's look into it and see what it is. Also, then, because of the new spot found on my left breast, and then the ones with the lymph nodes on the other side, the breast surgeon had me scheduled for an ultrasound, which then turned into a biopsy at my ultrasound. So I had the biopsy done, and the results came back on the lymph nodes on the right side as totally clear. The radiologist said she thought it might even just be something symptomatic, just something, in my body going on, that for whatever reason those lymph nodes seemed, I guess, enlarged or something. But when she got the biopsy results, it was nothing to be concerned with, which was good. The same with the biopsy on the new spot that was on my left breast. So good thing is new spots were found, but the new spots have turned out so far to be nothing of concern. I then had the CT scan of my liver, which I always Google things before going into them because I don't like surprises and I kind of like to know what I'm going into. The problem is when you Google things, you get sucked down that rabbit hole and all kinds of crazy things pop up. But I thought I had my mind wrapped around like how the CT scan would go. The one thing that caught me off guard, and I'm only saying this to people who might be having to have one, and it wasn't really that bad, but well, two things really. The first one being when they were putting the IV in me, and she was trying my left arm, she didn't think that the veins, like in this bend in my arm were big enough, so she tried down here, and it blew my vein. And she's like, oh, you have tiny veins, which everyone always tells me, which just makes me glad that I end up with the port, not having to be stuck with needles and having blown veins all the time. But they had to use a bigger gauge needle than their standard. I don't know if it was like a 22 gauge is what they use or something, because of the type of tests that need to be done. So brace yourself if you're having a liver CT scan, that they're going to use a bigger needle, and if you've got small veins or if you're a problem stick or whatever, it might be problematic. So that probably took the most time trying to figure out, they had to get the IV in. The second thing was when they injected, I guess, the contrast dye. She was like, let me know if you feel sick or if there's burning or you feel fullness in the injection site. She's like, but it is going to feel warm because it's going to go in quick and you are going to, you're going to feel it. So when she started to push it, instantly, like, my throat started getting really warm, and it was the most bizarre thing. I could feel the rush quickly through my body, and I got really warm, so warm that I thought I peed myself during the scan. So I was like, oh my gosh, what is going on? Cancer sounds like this is just stealing all my dignity from me. So I'm sitting there thinking, I mean, if I just peed myself, then I guess I'll just pee myself. Luckily, I didn't. That was just that warm feeling rushing through me, but it was so bizarre. Did not expect that. Did not find that on Google. So here it is. Now, hopefully this will show up on someone's Google search that you might think you peed yourself or something. And it was just not an uncomfortable situation. It wasn't like painful or anything, but just very bizarre. So that was kind of funny. But so I had the CT scan and got called back with the results. I think it was like the same day or maybe even the next day. The nurse from my oncologist called back. And unfortunately, the spots on my liver were not tumors or anything like that. I talked to my oncologist today because I met with her when I had my blood work drawn for chemo. And she said it might be something, I forget what she called them. Should have looked that up when I made this video, but it's something that you kind of just have on your liver, and I might not have blood vessel kind of thing, just like bigger blood vessels or something that are totally normal and not uncommon in people, but I just might not have never known I had them because before cancer, I wasn't getting scans and all kinds of stuff. So whatever, we're going to go ahead with an MRI because of my liver, because it's like she agreed. She's like, it's totally your decision. Either I could continue to follow up and see if there's any changes with these spots in my liver, or I could choose to do an MRI. And there's no radiation with the MRI, so there's no concern there. But we can get maybe a little clearer image of exactly what these spots are. So I was like, yeah, I mean, I'm not one for surprises or trying to play guessing games. So go ahead with the MRI. So that is scheduled, I think, in like 7 to 10 days or something. So I'll keep you updated on that. But that's kind of it, I guess, on the tests and procedures I've been having done. So I feel like every time I have a test, and she even said this today, it's like it leads to another test or another biopsy or something, which this, I guess, is just the world of having cancer and going through chemo, being stuck and having scans and taking a sample of this and that and whatever. So the odd thing is I was a person who had basically zero medical history to now one having the whole gamut of tests and scans and whatever. Just I guess I'm finding out more about my body than I ever thought I'd know. So thank God, all the news so far has been good news. The only thing is I was supposed to have my third infusion tomorrow, which would be the third of 6 chemo infusions, which would put me halfway through that. But for whatever reason, the booking got changed, and I'm going to have it Thursday instead. So it's just bumped back 2 days. But the good news is I feel really good right now. I feel like my normal self, so I get 2 more days to enjoy that. So I'm going to cling to that. But that's it for now. Quick update, let you know what's going on. Fingers crossed that round 3 doesn't start out with a bang, doesn't have any bangs going on during it, and that it's just kind of smooth sailing, and I'm on my way to being done with this. So pray for that. Fingers and toes crossed for that, and we'll just hope for the best. So that's it. Until later, keeping you updated. Talk to you soon.